Today, our topic, and Zoom has really made it a lot easier for us to talk about these things. Our topic is going to be about plantar fasciitis. And I have some slides I've put together. I have some examples, and I want to make sure that everyone gets all of your questions answered. Some people asked me some questions before, such as if I've had long-standing plantar fasciitis that has come back or how to prevent recurrence. We're going to go into that, but basically we're going to start with the basic treatment options of plantar fasciitis. We're going to look at the cause of plantar fasciitis, and then some of the more specific details I'll try to answer, but a lot of it is patient dependent and dependent on what symptoms, what type of treatment you've had, and we'll go over what works for most people. So once again, you can ask any questions in the chat box. I'm going to start by showing some slides here, and I'm going to kind of open the slides and then close the slides. So let's start here. Can everyone, I'm assuming everyone can see this little box here. This is the presentation, and actually this is the same presentation if you are one of my patients in the office. I've made some modifications to it, but we're going to talk about an approach to plantar fasciitis. I don't think I have the only approach. I don't think I have the best approach. In my hands, this is what works for me, and if it's beneficial to you, I hope it would benefit you. If you're a physical therapist, you can kind of understand how I think about plantar fasciitis and the role of physical therapy involved in plantar fasciitis treatment. This initial picture you can see, it's the bottom of the foot, and this is the most common area of plantar fasciitis. It's the bottom inside of the heel. Sometimes it can be in the center of the heel. Sometimes it can be more on the inside right here, but there's a lot of other things that might not be plantar fasciitis. There could be a bursitis, there could be a tendinitis, it could be one of the tendons called the posterior tibial tendon. Those are all big words. It could be a lot of other things. The first thing when treating plantar fasciitis is making sure that you have a correct diagnosis. And that might be from your podiatrist, from your primary care, from your physical therapist. Someone needs to help you make the correct diagnosis, and only then can you go into different treatment options. I'd like to explain what is plantar fasciitis, and I'd like to show you a little bit about the anatomy behind plantar fasciitis. If you see this picture in the center on top, you can see this little yellow line, this arrow, and you can see one's pulling up and one's pointing this way. What I want to explain by this picture is that plantar fasciitis, both the Achilles tendon, which is right here, and the plantar fascia, they insert into this bone. This is the heel bone. And for the majority of patients, they have a tight Achilles tendon, which might be something called equinus, which is the technical term, or just a tight Achilles or tight musculature in the back of the calf. And then also a tight plantar fascia. Because of this, and you can't just treat the plantar fascia, you need to treat the back of the calf. Actually, most of the time when I'm requesting physical therapy and recommending physical therapy, they're working very little on the actual fascia, and they're working more on the Achilles, on the knee, on the hip, on the core, on everything else higher up, or we call it more proximal. So higher up many times is the cause of the plantar fascia, plantar fasciitis. If you look at this picture on the right-hand side right here, and all these little lines, this is a figure of the plantar fascia. You can see this is the central band of the plantar fascia coming down, and you can see it flares out to go underneath the toes. The area that it typically becomes injured is right here at the insertion. What I want to explain is that it's not just in this area. It actually expands throughout this whole region. And what do you see underneath the fascia? What you see underneath are all these other muscles. These are called the intrinsic, or the muscles that are inside of your foot. They start on the inside and they end on the inside. And for many people, especially in our society, we are in shoes all the time, and our inside muscles become weaker. So we have weak intrinsic muscles. That's where physical therapy is very helpful for doing. There's some exercises I'll go over towards the further on in the presentation called short foot exercises. Basically exercises to help strengthen the inside of the foot, and we'll go over that. And then this bottom left picture right here, what I want to focus on, we took away the plantar fascia, and what we're seeing are some of the intrinsic and some of the extrinsic. The extrinsic muscles are these muscles that start outside of the foot, but they enter into the foot. There are many different muscles that start on the back side of the calf, like the Achilles, the posterior tibial, the flexor hallucis longus. And these, they insert around the same region as the plantar fascia. And many times foot pain is caused because of these other muscles, whether it's because they're tight and you're walking different, or because the plantar fascia is hurting and you're limping around and walking different. You can't just treat the fascia. You have to treat everything else above the fascia. That's what I would like to express right here. And just a reminder to everyone that's here, you guys can ask me a question in the chat box if you have anything. Otherwise, we'll answer questions at the end. When I see patients that have plantar fasciitis, I want to know from them how this impacts your life. If this doesn't impact your life, then you're probably not seeing a doctor or seeing a physical therapist or seeing anyone. The most common complaint is pain. And the most common type of pain is pain when people get out of bed in the morning, or they're sitting down for a period of time in the car or somewhere else, and they have pain when they're getting up. And that leads to frustration. That leads to them the inability to walk or do other types of exercises. And that can lead to weight gain. And then people, they don't get any treatment and they just think they're going to have to do surgery. I just want to reinforce to you, those that are watching here, surgery is the last resort. We don't jump into surgery, and there are a lot of good things that can be done to help avoid doing surgery. And then the fear of missing out of work because they can't be on their foot. A lot of people have standing jobs and then they can't be as active. So think, if you have one or multiple of these types of concerns and it's not getting better, you probably should see some type of a specialist. And the time of symptoms, I think, is real important as well. How long have you had your symptoms? I use a 3-month period as kind of a determining factor, even in terms of what types of treatments that I recommend. If someone has had this less than 3 months, you're probably on top of your health. You may have maybe went on a long walk and did something that kind of aggravated the foot pain, and then it's been hurting and you're going to seek help. That's a lot easier to treat than someone that's had it for 3 months, 6 months, years, 1 year, 2 years, 3 years, and they just think that heel pain is normal to live with. And it's very important that those that have had symptoms less than 3 months, or it hasn't been that long, you get treatment. You try some of these things that are noted below to start out. Okay, what are some of these things? So anti-inflammatories can be used. You can try that. Oh, I've tried that, or I can't take that. Well, then you should probably see someone if you're in a lot of pain. Icing is very helpful. Putting, everyone knows the bottle of water, everyone knows icing the area, but not many people know about something we're going to talk about in a little bit, and I'll preface it here, called contrast baths. I find that contrast baths are very similar to restarting your computer. You know, if you're having a computer problem and you just restart it and it kind of resets things, I find that contrast baths, so a bucket of ice water, a bucket of hot water, and you go 5 minutes ice water, 5 minutes hot water, and 5 minutes ice water. And that's about 15 minutes, and that, for some people, it really, really helps with the symptoms. Everyone tries stretching before they treat, they go to see someone. There are different types of stretches. I'll show you some here, but if stretching isn't enough, you need to see someone to help you with that. That's where I think physical therapy, I find that people, they do better, they get better faster when they have physical therapy. That's why I recommend it so much, and I'm a big believer of physical therapy. Shoe changes, once again, shoe changes, okay, are a big issue. Most people wear the worst shoes for the hardest work. Let's say you're going to mow your lawn, you're going to do construction, you put on the worst pair of shoes you have, and for a lot of people that doesn't have any support, and then that aggravates their plantar fascia. So making sure you're having a good, stable shoe. And all the females, they tell me, you know, doctor, these are ugly shoes. We'll talk about some brands like Hoka or Topo or some of these brands that we recommend. And I say it's for now, and it's not forever. For now, not forever, but changing shoes, or at least wearing shoes, is important. Try to avoid going barefoot. Try to avoid going in little flip-flops that don't have any support. There are some supportive flip-flops like OOFOS, that's OOFOS, and other types that offer more support. But for now, it's not forever. People try different shoe inserts, and we'll go through how to determine what's a good shoe insert for you. And have you tried any other treatments? So you have to think, what treatments, and this is what I ask my patients, what have you tried up to now? What's worked, what hasn't worked, and where can we go from there? Okay. So I have a comment here from one of the people here. I had a traumatic injury. A metal pole punctured my calf when I was about 19. Now I'm 60. And that's where my plantar fascia is, my plantar fasciitis is. You know, whether we can say, 40 years later, that was the cause of plantar fasciitis, I doubt it. Okay, certainly that muscle could be tighter. That could be a contributing factor. But when you're talking about, I think we try to make associations in our minds where just plantar fasciitis is very, very common. So it may not be that pull injury that caused it, but there certainly is hope for treatment. You'd have to have an evaluation to see how much range of motion you have in that ankle joint. What are the diagnostic exams that you should do? You can see here, I put a picture of an x-ray here on the upper right-hand corner, and there's a little spur. This is a big misconception that I want to clarify for everyone. Most of my patients say, doc, do I have a heel spur, or is it the heel spur, or is the problem the heel spur? I just want to clarify. In the past, I would say about 20 years ago, as podiatrists, we used to treat plantar fasciitis by removing that heel spur. And we realized their foot pain didn't go away unless you cut through the fascia. The heel spur is a reaction to the tension on the plantar fascia. So the pulling on the fascia, there's a law called Wolff's Law. If you pull on an area of bone long enough, it's going to produce bone in that direction. And that's exactly why you have the spur. Very rarely does that spur cause the problem. So I want to clarify that. If you come in and say, doc, I got heel spurs and it's going to be painful the rest of my life, that's not the case. If I get 100 x-rays on people with heel pain, 50 have spurs and 50 don't. Okay, so one of the misconceptions is it's the heel spur. Normally, it's not the heel spur. Occasionally, if it's a really big one, that could be the case, but for the most part, it isn't. So I just want to clarify. We still get x-rays, though, to make sure there's no cysts in the bone, making sure there's no other problems in the bone, okay? We also look at the architecture of the foot. This x-ray isn't the best. I like a weight-bearing x-ray, just so you know. Now the other pictures here on the left, the first and second one, you see here it says right plantar fascia and left plantar fascia. What I'm showing here, this is a picture of the heel, and this is a picture of this ligament right here. This is actually the plantar fascia between the two A's and the two A's. And what you can notice on the right compared to the left of this patient, the left one is thicker. In my hands, I find actually more beneficial than the x-ray is an ultrasound. An ultrasound will show me any areas of thickness. It'll show me any areas of injury, okay, or inflammation. You could also get an MRI. A CT scan isn't as beneficial, but an MRI can be helpful if you're concerned about a rupture of the fascia. Ruptures aren't all that common, but they can happen. Normally, they happen in people that get multiple cortisone injections within a period of time, and they hear a little pop. That's the most common concern of a plantar fascial rupture. The most common diagnostic exam I do is an ultrasound. I'll do an x-ray, and then if people aren't progressing at the second visit, I recommend an ultrasound to evaluate. You can compare one foot to another, and you can definitely see the changes. Those are the diagnostic exams. And the treatment options. If you come to the office, I'll always say there are 3 treatments. You can ignore it and hope it goes away. Okay, that's what the majority of people do. They ignore it. They might ignore it for weeks, might ignore it for months, might ignore it for years, and then they come and see someone. And that's not, you're not watching this because you want to ignore it. You want to do some treatments. Then there's conservative or non-surgical treatment. And then there's surgical treatment. I recommend holding off on surgical treatment for 6 to 12 months once treatment has began. You could say, doc, I've had it for a year, but you haven't done any real treatment. I wouldn't recommend doing surgery. I always recommend surgery as the last resort. I think in the last year I've done 2 surgeries. I don't do a lot of surgery, and we're very good. I'll explain a little bit about how to do the surgery later on, but I don't think you need surgery. The majority, I would say 99% of patients can get better without surgery. Okay. Let's talk a little bit about the treatment categories. When I talk about categories, I like to kind of rationally look at treatment in different categories. The first category is to reduce the stress and strain on the foot and specifically on the fascia. And what I mean by that is if someone has a very flat foot, it's going to put a lot of additional strain on the plantar fascia. You can see the picture on the left here where they're pronating in, they're flattening in. That's putting a lot more strain on this side of the fascia. Here's an example right here. One of the ways to reduce the stress and strain is to wear a good stable shoe. That's number one. And then also people try either an over-the-counter or a custom orthotic. When you're looking at an orthotic, what you want to look at are a few things. You want to correct the heel alignment. And what I mean by that, you can see how this heel is crooked, and in the orthotic, it's straight. And the only way you can do that is with an orthotic that has a deep heel cup. The next thing you want to do is you want an orthotic that's going to contour to the arch. And the third thing you want to do is it needs to be a rigid. You can't just do there are certain brands out there that are really soft. They're only a gel. They're not doing anything for you. So if you're going to buy an over-the-counter one, get a more of a rigid one. I'll put some links on what are the best ones in my opinion for that. I'm going to stop and spend some time and show you guys a few pictures in terms of orthotics, because I think this is so important. With an orthotic, you can see here, here's an example of a heel that stabilizes the heel. So we can either cant the orthotic to one direction or another direction to help realign that heel. And you'll notice that it has a deep heel cup, and that's a real important thing. And then the arch is going to contour. Now, this is something I cannot bend it. It needs to hold your 100, 200, 300 pounds without cracking. And this is something that's small enough that fits into your shoe. And there's different lengths. This is the most common one that we do. It's called a 3/4 length orthotic. I also want to show you a full length orthotic. If you're concerned which one you should get, most people do better with a 3/4 length right here if they're going to move it from shoe to shoe. If you have 2 or 3 shoes you want to wear, you just move it from shoe to shoe. Occasionally you can take out the sock liner. For those that are wearing one pair of shoe, usually men with like a work boot or in a workout shoe, you can do a full length. Or if they don't like the difference in the length where this drops off, some people get annoyed with this drop off in the orthotic, you can make a full length one. And this is made specifically, it really isn't doing much, this part up here, it's just making it full length for you. And here's a couple of types of orthotics. They both have deep heel cups, you can see here, and that's where your heel sits in, so that can hold it. This is going to contour to the arch, and they are all really rigid devices. Don't get anything really, really soft. If you can take it and push down with your fingers on it, and it bottoms out, kind of like a car that bottoms out, it's not going to do any good for you. Okay, so I hope that helps everyone to see that. Okay. So let us continue on here. Okay, so that's the purpose of reducing the stress and the strain. I always start with good shoes, and then from there, either an over-the-counter device, try that, and then needing more of a rigid device. Also, I want to talk a little bit about something called regenerative medicine. You may have heard about it. Our focus is more now on trying to use less cortisone, because we know that cortisone can weaken the fascia and it can cause issues with the fascia and other parts of your body. And many times what the cortisone does is it actually reduces the inflammation. But the inflammation has a process. For those that know a little bit about how inflammation works, you have to get through that process of inflammation to bring healing. And if you're only using a cortisone or an anti-inflammatory, it's reducing the inflammation. But if that tissue isn't healing, then we're going to have a problem. This is what we've used. I think it's going on 5 years now. It's called radial shockwave therapy. And this is the same type of a treatment that's used for people that actually have kidney stones. It's a different device. It's a much larger and it has bigger pulses. But what you do is you put people in the water and you shoot these sound waves at them in the water, and it breaks up the kidney stones. And with the plantar fascia, it's very similar. What we have here, you can see this device in the bottom. There's a little, kind of like a little piece of metal that goes back and forth with air compression. It hits this little tip. And based on the diameter of the tip, the bigger the tip or the smaller the tip, the more focused it goes. And then it penetrates into the tissue, causing the tissue to become injured. Because most people with plantar fasciitis, or we could use another term called plantar fasciosis, which is a thickening and kind of a scarring of the tissue. Remember I showed you on the ultrasound how it's thicker? With that thickness, what this does, I kind of equate it to a meat tenderizer. You're whacking the heck out of that plantar fascia, and then it's going to break down and send more blood flow to the area. So it's going to recruit all of the healing cells that can help heal the plantar fascia. That's how this works. I have the pain scale 5 out of 8 right there, because people that are in a pain level to 5 to 8, I recommend this type of a treatment. Now, if you have pain 9 or a 10 and you're limping all the time, then what I do is I recommend either a walking boot or a cortisone injection, because you're just dying of pain and you may need to get out of pain first so then we can start the healing process. Okay. There is a question, and thank you for answering the questions. Is it okay to continue walking for exercise while treating this condition? If you're having shockwave therapy, it's fine. If you're doing physical therapy, it's fine. What I recommend is I say, let pain be your guide. If it's hurting you a lot to walk, you probably don't want to walk, because you're going to change the way that you're walking. You're going to change your gait, and you could cause a problem in your hip or your knee or your back or something else. But if you are feeling comfortable, you certainly can walk. And then I really recommend deep tissue massage a little bit before, but mostly after, because that's when things get tight. But you can work out. We have a very athletic practice, and we treat a lot of marathoners, ultra marathoners, triathletes, and they don't want to stop training. And we're able to treat this using shockwave and other types of treatments so that people can continue to be active. But once again, you should ask your doctor, whoever you're seeing for this specifically. Next, I want to talk about this whole aspect of restoration and healing. A few things I want to show right here. I know everyone sees the needle and they get scared. This is something called an amniotic injection. This is what the latest and greatest, all these ultramarathoners, triathletes, people that don't want anything harmful in their system, they're doing. Okay. What I want to show in these two pictures, you see this circle here in the center. There's this little black area. When you look at an ultrasound, white and gray is okay, but black is bad. And you can see this black circle right here. And then post the injection, there's been healing of the fascia and there's less black. And this would be an amniotic injection. What this comes from, it's not exactly stem cells. You've heard of stem cell therapy. It's not actually stem cells. What it is, it's an amnion, chorion of the placenta of donating full birth mothers. And they take that in a tissue bank and they give us it, and we dilute it a little bit and we inject it right there. Why? It's because all of those cells have the most growth hormones to help bring healing in there a lot quicker. And it actually heals the tissue versus just reducing the inflammation. Does that make sense? And we do this with ultrasound guided injection. And here's kind of another picture here you can see of an ultrasound. Right above, there's an area of inflammation, and then right here in the fascia. So those are some of the latest and greatest types of treatments. That's called an amnio injection, which I'm a big advocate of it. So someone's asking me a question about massage, and I believe a massage tool is important. We're going to get to that here in a little bit. Just bear with me here. I'm going to, just to be complete, some people take anti-inflammatories. I'm not a big advocate. If you are doing amnio or if you're doing shockwave, you can't take these for shockwave 2 days before and 2 days after, because you actually want to recruit that inflammatory response. Okay, I think that's real important. But if you need to take it temporarily, you can for pain reduction. This is an example of the icing that I recommend for patients. A bucket of ice water and a bucket of hot water, not to burn yourself, obviously, but 5 minutes in ice, 5 minutes in hot, and 5 minutes in ice. And here's that bottle and these other types of ways of reducing inflammation. This is very effective for people. We talked about reducing tightness, and that was the question about massaging. I am a big believer in massage, whether it be self-massage, whether it be therapeutic massage, whether it be the Graston technique, which I guess you could call massage, that the great physical therapists over at Greendale do, okay? Once again, why? Because all of the problem is on the back of the calf, okay? All of the problem is in the back of the calf. Here's an example of a Graston tool, and you'll get the back of your calf worked on, and it'll loosen everything. And I recommend, I just think people, they get better faster with physical therapy. And I want to let you know, if I send you, and if you go to any physical therapy place of repute, they should do something called a functional movement screen. Basically, they're going to look at your whole body, because the plantar fascia may be a result of something else. It may be hip range of motion. It could be tightness in the quads, tightness in the IT, tightness in the gastroc. There's other areas in your body, especially the core. You could have core weakness. Core just means the abdomen. And all of these things cause you to walk and pivot and tilt and twist. And this could cause the plantar fasciitis. So doing a physical therapy evaluation, even if you're doing great, I think is good for most people. And you asked about doing some type of massaging. Here are some examples of some tools and how they work. These are called trigger point tools. You can buy whatever ones you want. We carry a few of these in the office, but this is the TP ball, and it's a yoga block, and you get deep in and you can get more compression by putting your foot on the other, and you do these different exercises on the muscles in the back of the calf. If you see someone, we can show you how to do that. If you go to PT, they can show you how to do that. This penetrates a lot more. This picture on the left penetrates more. I use it for athletes. It's great. If you're just an average non-athletic person, I think a foam roller is a little bit less expensive, and you can foam roll. You don't have to do this elevation right here. I'm not going to expect you to do that, but rolling the calf out can be very helpful once or twice a day. I find that reducing tightness, in my opinion, using foam rolling and different tools is actually more effective than stretching. Why? A lot of people stretch wrong, and a lot of people stretch too much, and they could actually cause harm or injury. Okay, that's just my thought. I don't know what the physical therapist, if you guys like to chime in, you could say, but that's my opinion. And here's just another stick. I have a couple of others I was going to show you here quickly. I brought a few of them here. So once again, this is that ball. People want to know how they can make their own. You can try like a golf ball. Golf ball is a little bit bigger. It needs to be hard, and maybe like a racket ball, and you would roll that not on the bottom but on the back of the calf, and you try to get trigger points. That's why you have to lift it up with that yoga block. So that's one example. This is the other roller that you put your calf on it, and it would roll it, and these kind of go in conjunction. There are a couple of and this is just the foam roller. Which type doesn't really matter. I like the shorter one only because the longer ones are hard to put in your car if you're traveling somewhere. There's a couple of new things that I like. This is another ball. It's a trigger point ball. It's actually a little bit bigger. This can be good for your piriformis or your butt muscle or your IT. It's a rigid ball, a lot bigger. These are really, really helpful. A lot of our athletes, they do well with these types of rolling balls. Okay, and then finally, there is something called Acumobility right here. This is basically, it sits on the ground and you roll over it. And there's different types of techniques. You can go on their website. And I'll put all these kind of links on the bottom of this video. It'll be on a YouTube video, and I'll be sending you the video. So you can look at the description underneath it to help you if you want to look at any of these devices. So there's hundreds of ways of doing soft tissue release. That's my thought. Okay. What I want to focus on though is if you're doing all this on your own and you aren't getting better, you probably should get some help. Okay. You should probably see a specialist. You should see physical therapist, your primary care, a podiatrist, just someone for some help. So I do agree that massage technique can be helpful. You notice a lot of this is on the calf and not on the bottom of the heel. Okay. That's always a big misnomer for people. You can massage a little bit on the bottom of the heel, but it's a hard area to get. Maybe with a golf ball you can, and I'll teach you some strengthening exercises as well. These are the exercises that are most common that you may receive from physical therapy or you've seen on the internet. A wall stretch is okay if you know how to do it right. If your foot is slightly off cant, you could do it wrong. You could do it too much. You could cause other problems. The same thing about the stair stretch. I think the stair stretch is fine if you know how to do it properly. I don't want you to overstretch. I don't want you to hurt anything. I don't want you to cause any Achilles tendon problems by overstretching. But these are some other ways of reducing the tightness for our completion. Now, I've put here a video that's going to have some different strengthening exercises that can be used. Okay, it's a 2-minute video. You don't have to watch it, but I wanted to give you a couple of ideas of what you may want to consider with these foot stretching exercises. These are on the Correct Toes website. So Correct Toes are like these liners that can go around your toes. And so there's different techniques. Some are taking a hacky sack. You can see that, and kind of pulling your toes down. This is putting your big toe down and kind of pulling it. These are all to strengthen the intrinsic muscles, kind of picking up marbles, picking up a hacky sack. These are going to strengthen the intrinsic muscles. So there's different names for these. One is called a toe lift. So lifting up the toe, strengthening the dorsal, the muscles on the top, the tendons on the top. This can be helpful. There are other lifting up the big toe or the other toes. You can do that too. These are all to help the intrinsic muscles of your foot. Something called toe presses. It's where you're pressing down on the toes to strengthen those. We're in a culture that's wearing shoes all the time. So we're not ever using our muscles unless you go barefoot in the sand or something else like this. So doing the big toe, doing the lesser toes, kind of pulling down to help with strengthening. Now, can I say that doing toe spreads, doing these strengthening exercises are going to take away your plantar fasciitis? Probably not. This can't resolve your plantar fasciitis. This is, once you're starting to feel better and you want to avoid it from coming back, you need to strengthen the muscles around the fascia. It's very similar to if you're having hip pain or other types of pain, you have to strengthen the muscles around it. So there are a lot of muscles that I showed you in that picture that are around the plantar fascia, and you need to strengthen it. So here's different ways of kind of strengthening, raising up the arch, and then these hacky sack curls. So there's a lot of different types. I don't want to over inundate you with these short foot exercises, but basically it should take you 2 or 3 minutes once a day, okay, for your foot, okay? That's something I think, it's not the first line of treatment for me. It's more like once you're feeling better, or if you want something else to do for therapy, you can do that. One of the big challenges for my patients, now I did mention it would be about 30 minutes. I think we're going to go a little bit over. I understand if you guys need to go, I'll be sending you a copy, but we're going to go a little bit more because I want to be complete with this lecture for you. The morning pain is a big problem for a lot of people. Here are 3 types of treatments. One is with just a towel stretch. That's the easiest thing. Basically stretching for 1 to 2 minutes prior to getting out of bed, and then putting on some type of a sandal, like an UFO or a shoe or something when you get out of bed. This isn't in the middle of the night. This is the first time, like if you get up to go to the bathroom, you don't do that unless you want to. This is like when you get out of bed in the morning, first thing. You can either do that stretch. You can also do foam rolling, get down on the ground, do foam rolling first thing out of bed. This is something called a Strasbourg sock. Many people, they actually get numbness in the toes from this and the night splint because it pulls it too much and they get some numbness. Might help you, might not. This is made for people that have morning pain, and then a night splint. So I know people have some questions about this. So let me just show you a little bit about the night splint here. Here's an example of one we have in the office. There's one that's called a posterior night splint, which is on the back of the foot. And there's another one that can go on the front. I think the back one is just stronger. Okay, it works better. There is an anterior or a dorsal night splint that you can use. With a night splint, it has these things that you can regulate how much tension it lifts up. Okay, and then there are a couple of straps holding your foot in. And I want to be very clear. Most people can't last all night with these. Okay, you start out with it and then you kick it off in the middle of the night. Some people that are really deep sleepers, they can wear these all night, but it's not all that common. And the other thing, it comes in a romantic gray color. Okay, that's what I wanted to tell you. It's a romantic gray color with the night splint. But if you don't want to do the night splint, you can certainly do something else for that. Okay, let's go on here and talk more. So that's for the morning pain. And then if you're having a lot of pain, there are different types of ankle braces and boots and taping. How do I think about these? If your pain is an 8 or a 9 and you are limping with every step, or you have like an amnio injection or a platelet-rich plasma injection, then I'll put you into a walking boot. The majority of my patients do not go into the walking boot. But if you tried everything else and nothing's worked, go into the walking boot. Now, a word to the wise, if you ever go to a doctor for a fracture or for a walking boot, I always ask them for this thing here, this little picture. It's called an even up. Basically, if they don't have it, buy it on the internet, because otherwise it's going to throw your hip, your knees, your back all out of whack, and you're going to have a worse back pain than you were a foot pain. Okay, good tip for you. There is a brace right here. It's like an ankle brace, or it's called a velocity or a agility brace. This brace, it has kind of like an orthotic in it, and it stabilizes your foot and stabilizes the ankle. So for example, in that example I showed you that they flattened out a lot, that can be used. And so it has kind of a brace on the inside to not allow you to, here's an example, I don't know if you can see it right here, but it has some straps and it doesn't allow you to flatten. So it has an orthotic built into it. That's like an ankle foot orthotic. And then taping, whether it be a low dye taping like this picture on the bottom right hand, a lot of the patients that go to physical therapy, they get kinesio taping. That's fine as well. That can be for the plantar fascia, for the Achilles tendon. Those are with KT taping. That can be helpful for you as well. Okay. And then I can't emphasize enough how many people I see for plantar fasciitis, and I just have them get a good shoe. It improves their results. Everyone that goes to physical therapy, they're going to look at your shoes. It's my obligation. And everyone comes in and apologizes. Oh, doc, I'm sorry, I'm not in the right shoe. It's for now. It's not forever. What are some of my favorite brands these days? I really like Hoka's. Hoka's are really doing a good job with the architecture of the foot. That's the one that looks like a double stuffed Oreo, a real thick one. Asics are good. New Balance are good. I try to avoid, nothing against these brands, but there are some brands that are really cute, but they don't offer any support. Nike, Reebok, Puma, Skechers. I think they're real popular. They do a lot of marketing and advertising. And how much should you be paying for a shoe? Between $90 and $120. How long should they last you? They should last you 6 to 12 months, depending on usage. If you're using them every single day and just for normal walking, maybe 9 months to 12 months. If you're doing a lot of work and you're working in them all day and exercising, maybe 6 months. It shouldn't be every 2 months. If you're having to get shoes every 2 months, it's probably the incorrect shoe for you. And then there are some advanced treatments. It's kind of beyond the scope of this lecture, all these advanced treatments, but I want to just point out, what are the advanced treatments your doctor may do for you? Shockwave therapy, that's something that we do pretty much for everyone. You do between 3 and 6 treatments. They last about 10 minutes. We do them a week apart. Very, very effective for plantar fasciitis. Amnio injections, we're doing more and more of the amnio injections for patients because they want to speed up the healing. They want to do everything they can to get better faster. That's why we do it. Those are expensive treatments. I want to be very clear. They're not super inexpensive. Okay. Merrill. Okay. Someone asked about a Merrill. Yes, I'm sorry. Merrill are a very good shoe. Keens are a good shoe. I can't name all the names, but where I recommend is going to a good shoe store. I recommend, there's one in Worcester, because we're kind of in Worcester and Shrewsbury, would be Sneakerama. They do a really good job. We send most of our patients there. There are other places. I would go to a sneaker or a running store where they can watch you walk, or get a recommendation from your doctor, an actual prescription. We do shoe prescriptions, which ones we recommend that you would get. Don't just go, I don't want to mention any names, don't go to a discount place. You're going to get them for $30 or $40, because those are the lower level shoes. There's different tiers of shoes, just so you know. There's the higher quality ones, and then there's the lower level ones, and you get what you pay for on your shoe. Okay, so that's what I would recommend, the local store. I think that answers your question. And then in terms of orthotic, that's a real good question. If you get an orthotic, sometimes you need to go to more of a neutral shoe. With shoes, they have a neutral shoe, which is basically for a normal foot, not a really flattened foot. There's an anti-pronation shoe, which is really, really common for a lot of people with plantar fasciitis. And then there's almost like a high arched foot type of a shoe. If you have a really rigid orthotic and you're in an anti-pronation shoe, sometimes it pushes you over the limit. It pushes you up too much, and you may have to go to a neutral shoe. So that's what I recommend. That's why I always say, try the shoe first, and then you could add the orthotic to it. You may have to take the sock liner out. And then the last thing is platelet-rich plasma. We used to do more of this before we had the amnio. The amnio is frankly just easier. That's why we do it. It comes in a vial, and that's how we can inject it. Platelet-rich plasma, we have to draw out your platelets, your blood. We spin it in a centrifuge, and we ultra concentrate your platelets, which are the healing components, and we inject it right into the area. And then lastly is the surgery. I try to avoid surgery, but I do. I had one last week. It's actually not that bad of a surgery. You basically make a little incision. You can see my pointer about 4 centimeters from the heel, make a little incision, a 2 centimeter incision, and then just cut through about 2/3 of the plantar fascia to relieve the stress on that. I really like checklists. So if anything you take from this, if you even go to your own doctor, your own podiatrist, that's fine. Bring this checklist. I think checklists are helpful. Everyone uses checklists, pilots, in every industry. And I think this helps me, not the first time you come into my office, but this helps me the 10th time you come to my office and you're still not better. And then we can kind of review. These are the most common types of treatments and what have you tried? And so just to review again, for the imaging, we get x-ray, then if you're not getting better, ultrasound. If you're concerned about a rupture or something else, we could do an MRI. And then traditional treatments, as I talked about, categories to heal and repair it. So this is natural, would be shockwave, amnio injection, PRP. If you're only wanting to reduce the pain, a cortisone injection. Why do I put 8 weeks down there? Basically, I put 8 weeks because I don't like to repeat them for 8 weeks. That's why I do that. And I don't do more than 3 in a year for the majority of patients. Anti-inflammatories, icing and contrast baths, and then reducing the tightness. Physical therapy, I always start with home therapy and stretching. You could try a night splint, then physical therapy. Now be aware, there's tons of things you can buy online. If you spent over $200 on things online, go see someone, okay? Don't spend $500, $600 on treatments. You're just throwing the money away. You need to have someone evaluate it because it might not be that problem. It could be something that could be resolved with some physical therapy or shockwave or just some basic recommendations. Taping, supportive shoes are really helpful. That's a best way to start. Then whether a custom or non-custom orthotic, an ankle brace, sometimes walking boot. And then the advanced treatments would be surgery or even getting a second opinion. If you're not getting better, and you've been seeing someone, you got those basically, oh, he had me come in for 3 cortisones and I got the orthotics and I'm still not better. You might want to consider seeing someone else just for a second opinion. I frequently ask my patients to get a second opinion from one of the other doctors in the office or another doctor in the community. That's fine. You have to get help for yourself. Okay. And then I'm going to send you guys, if you want to learn more, there's a little booklet I put together. I know it looks nice, but I didn't do that. I just something called Fiverr where I had them design it for me for $5. Okay. I put together a little booklet. Basically, this is what I give to all my patients. It's a PDF. If you get the slides, you can download the book by clicking this link. On YouTube, there's a lot more videos. You can look at my videos. You can look at other people's videos. Just make sure you evaluate the source. There's a lot of misinformation out there. That's why I like to do these lectures for everyone. If you're kind of high tech and you have a cell phone with you and you're not on your cell phone watching this, you can take a picture of this presentation with your phone right now, and it'll download the slides. So, hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.